Hello, everyone. Welcome to our New Year Better You Zoom event. I'm Dr. Tess, and we're just going to give a few minutes for people to get in here and join us. We are broadcasting from our M Beauty Life Center here in San Diego. We have 3 locations, M Beauty Clinic. We have a San Diego one, that's where we are here. Our clinic is downstairs, and this is our life center where we, do demos, we do courses, we do yoga. This morning, this was a whole entire TV studio. I was filming with Fox 5 and KUSI. And so this is kind of like our multi-purpose room. And while we're waiting, I'm going to introduce some members of the M Beauty Clinic family, literally my family. This is my brother, Rick. Say hello.
Hello, how are you doing? Just want to say hi and Happy New Year, actually.
Right, New Year.
That's what I was going to say. Happy New
Year.
Year. Hopefully you guys had good holidays. We just had our holiday party. I don't know if you guys follow my sisters and social media. We got some good photos and some good video.
Some good karaoke too.
Yes. Oh my gosh.
Oh,
She knew all the words. Tina, come over here.
She was like the
16-year-old
that knows every song. Not a good singer. I'm just loud.
Yeah, so this is Tina. Tina,
that was even before alcohol, like no alcohol.
Yeah. Like singing. We do karaoke with the family too, so
it shows. You're very confident. Awesome. So, okay, so what we're going to do today, since it's 2024, it's New Year, is we're going to talk about some of our latest treatments and maybe treatments that you've heard of, but there are new FDA clearance and the Sofwave. And Sofwave before the new year had incredible, exciting new FDA clearance for treatment of the appearance of skin laxity in the upper arms. And this is definitely an area where most of us would want some tightening, right? And so what we're going to do is we're going to demonstrate that live. Sofwave we've had for almost 2 years now, and I must say it's one of our most popular treatments. We love it. I think all of us have had this treatment, and it's we love it because it works, number one. Number two, there's little to no downtime for most people, and within about 1 to 3 months we release the results. So those who are just joining us, welcome. You're in the right place. This is a New Year Better You Zoom event with Dr. Tess and the M Beauty Clinic family. 2024 is a very special year for us because we are celebrating 20 years. We're celebrating 20 years of being in private practice, and we really are proud that we've served thousands of patients from all over California, San Diego, LA, and we definitely have patients as well traveling from all over the United States and even all over the world.
Canada?
Yes.
A lot of patients from
yes,
Canada.
To come see us and experience some of the cutting edge technologies that we offer for dermatology, aesthetics, and regenerative medicine. So also one of the things that we wanted to do is talk to you guys about, how our skin has transformed over the years, because some of the people here that you'll see have been with us for a long time, and we'll be able to see. So we'll start with Valerie. She is going to be our demo patient today.
Happy New Year.
Yes, you all. All right, Val.
Thanks for coming in.
All right, go ahead and tell them what you do and how long you've been with us and the treatments you've had.
Yeah, so I've done a little bit of everything. Initially, one of my target treatments was acne treatments. So I needed to get my acne under control, whether it was a little bit of hormonal acne or just not taking as good of care of my skin as I should have. I started doing our Tri-beam acne laser at the time. I've done Hydrafacials. I've done our glow peel. And it's actually made a really big difference. I didn't realize how much acne I was actually dealing with until we put together some pictures today, which I believe we'll show a little bit later. But started out doing acne, couple years in, jumped into some Botox and Jeuveau, really loved it, some fillers, and of course, skincare. Those of you who see me at the office, I'm sure you know, I speak so highly of our skincare. I love, love, love skincare. And I'm the person, you know, aside from Sheena, you know, we really go into skincare as much as we can. So I'm a huge fan of that, but those would be some of my main treatments. What else have I done? Oh, I've done Pixel, loved Pixel. If you haven't done Pixel, everybody needs to do Pixel. Everybody, whether you're looking for a little bit or a lot, you have to do Pixel. So I've done a little bit of micropen and PRP. I've done PRP for my scalp. I've done quite a bit, actually, now that I'm talking about it. Hey, guys.
Okay, let's show your photo. So this is like a challenge, and I really am so grateful that they're willing to share this, because these are not glamour shots. These are the photos that we take in the clinic before you do your treatments. And so, you know, like I just had this idea because I am so proud and I'm so touched that our team members have really been with us for so many years. They're believers of our technology. When you come here, they are going to be the best person to educate you because they've experienced it. And it's truly important to me that our team members experience the treatments, because then you're not as passionate. You're never as passionate about it. You see, you've heard how Val is so passionate, because you see the transformation in your own skin. So, okay, Val, go ahead.
All right, guys. Dun, dun, dun. Can you see it?
Yeah.
And that's in about a 5-year difference.
Show the before first.
So this is our before. Okay, look at the details around my mouth,
so
my eyes.
she has like a lot of discoloration, redness, maybe some acne, discoloration in the upper lip. You know, the under eyes are a little darker there. And that was October 2018. And then this was September 2023. So that's a 5-year difference. And I was telling her, Val, you don't look any older. And her skin is a lot more even. Obviously, acne's gone. Discoloration's gone. Redness is gone. The dark circles, the upper lip pigmentation, she looks more chiseled now as well.
Looks better. Yes.
So, yes,
it works.
Absolutely possible to really have healthier, more glowing, more beautiful skin, and preserve and maintain your youthfulness as years go by. So thanks, Val. Okay, so while Val is here, we're gonna bring in Sheena. Sheena's gonna tell you how long she's been here, and also I'm making her reveal her before and after.
So I've been here with Dr. Tess and M Beauty and the whole family for, this is my 9th year.
Nice.
And it's weird because it doesn't seem like it's been that long. But my skin has definitely improved since I started. I took a picture. I pulled up my very first picture and then to today, because I used to have a lot more acne, acne scars, you know, issues with texture, large pores. I had more acne prone, oily skin. Now that I'm a little bit more mature, I don't have as much
You're not
acne.
gonna ask how mature.
But it's also thanks to all the Alumier products. I've done a lot of acne treatments that Dr. Tess, Angela, and Rick did for me in the past, including the Tri-beam, the acne laser. I recently just did Pixel and I loved it because I
That's
needed
radio
some
frequency microneedling.
tightening since, you know, going up in the years. But we don't want it to show. We have a lot of things that we can help you with if it comes to just your overall skin quality, you know, evening out the skin tone, helping with sun damage, pigment, because of course all of us down here in Southern California, we love the sun. But we have some good recommendations and amazing products that can really help
Yes,
boost your skin.
we'll go over some of those. So, okay, reveal. Where's your photo?
Oh, about has right here.
Oh,
Yes.
I'll go in.
That was me.
I can't see it. Is that good?
Years ago. Oh my gosh. No,
9 years ago. Okay. Right? Okay. So this is the before. There's the date. October 2015. And yeah, it's just the brightness, the pore size, texture. There's acne. There's some discoloration. And this was January 5, 2024. Yes. And this was even before the radio frequency microneedling, and you can see the improvement in the overall brightness, the luminosity. That dermatologists love to talk about luminosity, because when the skin is tight, when the pores are smaller, the texture smooth, light reflects off of the skin as opposed to her before here, and you can tell that acne is resolved. The texture, you can't see the pores. It's like glass skin. Oh my gosh. And of course the discoloration is better. And she does not look any older 9 years later, right?
And she looks even better than this too, because this was before her Pixel lip
Yeah,
laser.
now she looks.
And then we sprinkled a little bit of Jeuveau a few days ago
Woo!
too.
Yes. And so, you know, you can't, like I said, we can't argue with results. So hopefully, those of you who are joining us are getting super, super excited at what is available now for us. We're celebrating 20 years, and I can't believe it. And people who meet me, and even our patients have been with us for a long, long time, or they haven't seen me. Like last week, we had a couple of patients who haven't seen me for 5 years, 7 years, and they're like, "You look younger now. You have better skin now. And you look more attractive." So I'll take it. Since possible. Okay. So now what we're gonna do is we want to show some videos, because we promised we're gonna do some demos of some of the hottest treatments that I'm perceiving for 2024. And so, like I said, Sofwave, we're gonna be doing a live demo. We'll prepare for that while you're watching some videos. So we'll queue up the video today. Like I said, I filmed for Fox 5 and KUSI for a show called The Localist. And the host of the show, her name is Ashley. And after we did all of the filming, she's like, because she's seen a lot of the before and afters. We've done segments, and she's like, I want treatments. And so she was complaining of heavy upper eyelids. And she's not, she's maybe, I'm not gonna guess, but it's not old, but genetically she has heavy and droopy eyelids. It bothers her a lot. And so what we did is our Sublamax plasma treatment, cat scratch treatment, and then we also did Sofwave, because Sofwave is FDA cleared for non-surgical brow lifting. So we're gonna show the Sofwave. We're going to show the cat scratch right now. Great. And then while we're doing that, we'll get Val ready. And if you have any questions, please type it in. Which box is it? There's a box, Q&A box. Just type your questions. Lisa is looking at those, and she will shout it out. And then I will be able to answer, because I want this to be as interactive and helpful. And this is a cat scratch, and this is a plasma pen, reflector, and it's delivering plasma energy to the skin. As it's doing that, it's causing sublimation. What you're hearing here is actually the smoke evacuator. Yeah, so it's a little noisy, so sorry about that. Wait, we'll lower it, thank you. So we have a smoke evacuator, but essentially what's happening, go ahead and play it again without the audio. Play it again. So what's happening here is a process called sublimation. So we are taking actual solid skin and then we are converting it directly to air, to gas. And that's the process called sublimation. So it's not really skin tightening. There are different treatments that cause skin tightening. Sofwave we use for the upper eyelids for skin tightening. This is actually removal, non-surgical removal of the skin. So it acts like a non-surgical blepharoplasty of the skin of the upper eyelid. So this is a very common and very popular treatment for our patients who complain of a lot of loose extra skin of the upper eyelid. Okay, and then what's our next video? Okay, so we did this, and because there is that instant removal of this, we're showing it to her now. This was just today. We also did Sofwave on her forehead. What do you see?
I see higher brows.
Yeah.
Oh, I can't wait. Ooh, that's crazy.
Yeah. You're gonna be swollen from the Sublimax, the upper eyelid treatment. But the Sofwave, it's really, if you just did Sofwave, you can just put makeup on and you're fine. Okay.
Ah, and I can put makeup on.
Awesome.
Yeah. Okay.
Okay.
They're gonna do a special
So,
cover up.
we did Sofwave for her forehead to lift her brows, because when you have heavy lids, there are two things that are really contributing to that. There's the heaviness of the upper eyelids. There's extra skin. Sometimes it's a genetic issue. And then there's also the dropping of the brows, which is why if you went to a plastic surgeon, they will talk to you about both a blepharoplasty where it actually cut out and remove the extra skin. And they also will talk to you about a brow lift where they actually pull up. Can't pull mine up because I've been getting Sofwave treatment and other treatment on my eyelids. So she saw the improvement right away of that brow lifting effect from the Sofwave, and then less extra saggy skin on the upper eyelids. They're asking us to repeat what it's called. Yeah, so the cat scratch is the Sublimax cat scratch plasma treatment for the upper eyelid. That is our non-surgical blepharoplasty. It's beautiful in combination with the FDA cleared indication for Sofwave for non-surgical brow lifting. Okay, next.
Did they ask why?
Next video. Good question. Again, if you guys have questions, I want this to be very interactive. Our next one is, okay, stop. Don't play it yet. So, okay, so one of the procedures that we are very, very well known for is our time machine procedure. And the time machine procedure is not really one machine. It is actually a combination of customized procedures, customized treatments that achieves really just turning back of the hands of time. And so what you're going to see here is a patient, and it's actually Marla Maples, who flew here from Florida, went and drove from LA to San Diego to visit us, right? This was just, I think, a week ago. And we did the time machine procedure. We combined Fraxel laser, Sofwave, Pixelift's RF microneedling. You're going to watch me apply platelet-rich plasma and also exosomes, the Keravive Empower Exosome Serum. So go ahead and play it. So her skin is going to be slightly red, and we do this. We do the time machine not just for the face, but we did it for her neck, her chest, her hands. So you can see we've already finished all of the energy-based treatments. So the skin is already, you know, a little red, a little swollen. Now I'm applying the platelet-rich plasma, and then I applied the Empower Elevite Empower Exosome Serum. And exosomes are really, really hot for 2024. And what I'm doing right now is I'm doing extra microneedling to allow channels to create little tiny channels for the growth factors from platelet-rich plasma and the exosomes to penetrate the skin. So it really will, one, decrease inflammation, decrease downtime, decrease redness, that burning sensation, and optimize her results. So that's what's happening there. And so in one visit, we can really do a lot of treatments and in different areas. Okay, next. Yeah, let's just move this so then Val and Gina don't get tired looking at it. Okay, all right, let's go here with Angela. Okay, come here, Ange. All right, so you guys can chill. It's hard to be on, people don't realize, because I do a lot of TV, how exhausting it is to be like
On, and then you realize, you know,
and
it's
your
like,
posture.
yeah, and then you tell
and-
people, like our staff, right? So they have to be used to being on camera. So I'm like, hey guys, you have to look at the camera. And then when you're not being spoken to, you're still looking at the camera, but you have to smile, but not too big.
So that's
But
why I'm
you
like,
have to
okay,
smile.
I'm feeling bad for them. Okay, let's do it this way. Okay, all right, next. Okay, so two questions. Okay, so the healing for cat scratch, the first couple of days, you will have some swelling. Oh, okay, go ahead, Ange, you answer. Give
Oh,
me a
I'll do
break.
the second question. Go
Okay.
ahead. You're on a roll.
No, I'd rather you. Come on, give me a break.
Rock,
I've
paper,
been
scissors.
speaking,
I gotta give
I've
you a
been
break.
speaking all day. I filmed
Angela
5
can do it.
segments.
Angela can do it.
Angela,
Yeah.
go.
You know who else can do it?
No, you do it. No, you
Rick
do it.
and Angela could do it.
Okay, you do
We
it
love
now.
doing this. You could see we're like trying to like pass the buck to each other. So here's my
scratch.
other
Oh,
our
okay.
other fellow
Mhm.
nurse.
I don't know if you guys know, we got this gift from for our holiday. Look at this.
They're cool, isn't
Yeah.
it? And Beauty Clinic, and then it's personalized.
Mhm. It says
Cool, huh?
anyways, cat scratch.
You
I
do
would
a lot
say-
of cat scratch.
I do.
procedures.
Yeah. So what I tell patients that you got to use the exosome. Sometimes we actually tell them to massage because it's a burn. So you know,
Which we did for Ashley.
you want to go and ask her?
Oh, yeah, go ahead, good, sorry.
She never.
I thought she's
I know,
resting.
but she's resting. What's happening again?
Never.
Okay. The short answer I would say between 2 to 4 weeks is really is the healing time. Some
So there's an initial
people.
phase of healing. So
You
like,
want to do?
so okay, well,
No, no, go ahead.
so there's an initial phase of healing. I like to call
She
it.
just came from her other work. Look at her.
So there's a social downtime, I like to say, where you don't want, if there are people who you don't want to know that you had the procedure done, you probably don't want to see them
Mhm.
within the first 2 weeks of having the procedure. So that's the initial phase of healing. After that, the scabs are gone. You're left with like a little bit of like pink tint to the area that was directly treated. That area eventually will return back to normal and you can cover it with makeup. So short answer to this is 2 weeks initial phase of
Mhm.
healing, about 4 weeks total for the skin to totally return back to normal. This can vary depending on your skin type, just how you heal. And honestly, sometimes it's just, you know, luck. We try our best, but 2 to 4 weeks.
What I've noticed is that.
That's enough.
Okay, that's it. All right.
Next question. Oh, my, why do we get
Angela
so
will do it.
excited?
Angela will do it.
So is Sofwave great for neck tightening? Oh my God, is it? Sofwave is actually FDA approved for many places on the face and body, but I believe its first place that it was ever indicated for as far as FDA approval
My neck
was the kind of like the jowls and the double chin area.
Yeah, it's called
Oh, it's
submental area
so good.
right
I have a
here.
picture. Hang on.
And I definitely feel Sofwave is one of the best technologies for non-surgical skin tightening
Can you
of
see
the
this?
neck. My neck. There you go.
I'm trying.
Closer.
I am getting closer.
That's good.
It's glaring. Sorry, we happen to just have this kind of on hand on our phone, but this is a picture of the neck, and you can see almost like the the laxity right under the chin. You can see some of the neck bands. And the Sofwave is just, it's such a wonderful treatment. Honestly, you can feel it when you are getting the treatment done. We'll coach you through it, but you sit up from the bed and it looks like nothing's happened. It's a miracle.
Yeah, I mean, I've done like hundreds of time machine procedures, using the Skinfinity, using the Pixel. And if it's true skin, like loose skin for the neck, Sofwave is the best. It has to be the true loose skin though, because some people say, oh, it's loose, but then it's really like you have fat, that makes it loose. Then that's not, it's not as good. But if it's true loose skin where, you grab it and then it stays like that, then it's really awesome.
Right. So, and also we can do combination treatments. So that's why I really encourage all of you, if you have questions and if you have particular issues, we offer free consultation because we can create a special personalized package for you. Like for me, and what we love doing now is combining Sofwave with RF microneedling and exosomes or
We're fresh
PRP.
off of that.
Yes, that's what we
That
did.
was what,
Thank
4
you.
days, 5
Yes,
days ago?
Saturday.
Yeah, just on Saturday.
What do you
We're
guys
fresh
think?
off
It
of
works
our.
better with Dr.
I'm not gonna say
Excuse
anything.
you.
Oh, I'm
First
just
of
kidding.
all,
I'm just kidding.
I'm tired.
Exhausted.
Yeah, I'm not exhausted.
I
that's
have
the
2
thing.
small children that are stealing my
All right, let's
youth.
do some. Let's do
it,
some
let's do it.
Sofwave. Go ahead and start the Sofwave. Yeah, and then we're gonna show you
It's
a
not
video.
comedy show.
Yes.
Brothers, what are you gonna do with them?
Okay. So, so the next thing that we're gonna show you a video while we're getting Val ready, is platelet-rich fibrin matrix. We get a lot of questions on how to address the under eye area, okay, and maybe the temples when it is losing volume. I am in the camp where I really do not recommend fillers for the under eyes, for the temples, the nose, the glabella. Those are truly danger zones. If you get unlucky, you can get blind. It is irreversible. Blindness is really a known complication. And for me, that is a no-go zone. I'm not going to do it. The other thing is that when you get fillers done here, it has to be done just perfectly. And even then, you can have significant swelling, lumpiness, where it's visible. It can draw fluid, and then your cheeks can look puffy. So what I do for my patients and for me, and you'll see the video because it's me, I practice what I preach. I'm 52 years old. You're seeing my skin up close. I use platelet-rich fibrin matrix. I use very little hyaluronic acid filler, maybe a little bit in my lips, maybe tiny bit sprinkled here and there, but really, I really rely on regenerative, natural volumization with platelet-rich fibrin matrix. And how we harvest this is through a blood draw. We harvest your platelet-rich plasma, then we process it, and then it is injected right away, and it acts like a natural filler. And I'm telling you, it works. You have to do a series, like as we have done. Angela injected my temples. Rick has injected my under eyes, and you'll see this in this video. Okay, so that's how we handle. Yes. Okay. Yes, we'll do it, but we're gonna show the video first. So we'll show the video of platelet-rich fibrin matrix for natural volumization, and this is me that is getting the treatment here. Rick is injecting me with PRFM for my under eyes. So part of the reason you get under eye bags, dark circles, is you lose volume there, and the skin gets loose, and it basically gets thin as we age, and it's already thin. So here it is. Rick is just injecting. It's almost painless injection. It's very simple. It's very quick. You can get some bruising. You will have some swelling in the area, but over time it builds collagen. It improves, and it takes that skin to a younger state. And you guys can see mine. I used to be very self-conscious about my under eyes. Now, not anymore. All right, so there are things happening here. we have Angela. Go ahead and talk about what we're doing.
So I'm doing the Sofwave on Valerie's arms. The goal here is we're trying to target the dreaded bat wings. These are kind of the little pockets of fat that hang on the bottom of the upper arm. Bat wings.
Bat wings.
Thank you. But it's actually very effective. You do get immediate improvement right as we're doing the treatment. And then it will continue to improve over the next few months. Valerie's actually pretty comfortable right now. There are some areas that I like to say get kind of spicy, but very tolerable.
Very tolerable, guys.
How does it feel, Val?
Feels good. It just feels like a little bit of warmth. Not anything that would have me jumping out of my seat. And I'm chilling. I'm chilling, guys.
Yes, so like I said, Sofwave got FDA clearance for the treatment of the upper arms for skin appearance of skin laxity. And many of our, our celebrity patients love this because it's an area that in the past, there's really not much that you can do besides, having surgery done. In our clinic, we have a technology called Renuvion J Plasma. And I also perform sickle liposuction, right? Liposculpture. And so the combination of sickle lipo, if what we're talking about is fat plus loose skin, that's a surgical approach where you can have lipo to remove the unwanted fat. And then on the same day, use the Renuvion J Plasma, which delivers radio frequency underneath the skin. And then over time, builds collagen and tightens and remodels the skin there. So Sofwave works through proprietary ultrasound, but how it works is that it is creating heating underneath the skin, and that activates our wound healing response. And so over time, we will develop new collagen and elastin. And so that is how the areas get lifted without surgery.
I have a side note about what you had just said. So there's over the years, that's how we describe a lot of the treatments that we offer, right? Where it heats under the skin and then eventually you do get long-term tightening. But the Sofwave, I have to say, is just so amazing at it, where it's just like not all laser treatments are created equal. And then on top of that, not all practitioners who perform it are created equal. So yeah, like who you go to matters and the machine that they're using matters.
Absolutely. So we definitely have had patients who've had Sofwave at other places and they say it didn't work. And then they come here and treat them and they're so happy with the results. So absolutely anything that you're dealing with as far as technology, machines, injectables, who does it for you? There's such an art to really delivering an amazing treatment and to getting a great result. And we've been doing this for 20 years. And I must say we have thousands of happy patients. And that's why we all love what we do because we know we're making a difference. So that you'll just keep going with that. And let me just mention all of the FDA clearances for Sofwave.
Yeah.
Since we're here, the arms, non-surgical brow lifting. That I think is one of the best places to get Sofwave done. And we mentioned that a lot with Ashley. She had that done along with the Sublimax for her upper eyelid. So if we're not doing the Sublimax, what we would do if we really want to lift and improve and open the eyes is treat the forehead plus the upper eyelid with the Sofwave. Sofwave is FDA cleared for treatment of facial wrinkles and fine lines. And so because you're building collagen, acne scars.
That's a new one. That's very exciting.
Yes. So, if you're like over the age of 30 and you have acne scars, you're getting 2 for 1. You're killing 2 birds with 1 stone because you are getting non-surgical lifting. You're getting snatch in like your cheeks and jawline, and you're filling in your depressed scars. So that's really, really cool. And then the submental area, which is the skin under your chin. So the laxity in the submental area. That's like, if you're going like this, like, people start noticing that in their maybe early 30s. Some of my patients, even in their 20s, if it's a genetic issue, that tightens the neck. Angela talked about that, non-surgical lifting of that. Also, it helps with temporary improvement of the appearance of cellulite. There's really nothing that
No cure
permanently
for
cures cellulite, but from personal experience, because Angela's treated my thighs, my knees, my inner thighs, the back of my thighs.
Body by Sofwave.
Exactly. It works. It works. But you just have to have realistic expectation.
Question.
Question.
How long does it last? How long does it last?
The results?
How
Yeah.
often did you need
Great question. So the question is, how often should you get Sofwave done, and how long do the results last? So what we're talking about when we're talking about Sofwave or the radio frequency microneedling or time machine, is regenerative therapies, regenerative medicine, which means you really are. If I took a biopsy of your skin wherever we're treating, and then we did Sofwave and waited 3 to 6 months, and then took another biopsy of your skin, then your skin 6 months after your Sofwave will appear younger under the microscope. Histological changes, if you stain for collagen and elastin, you will have more collagen, more elastin. And so it is truly a reverse of the aging process of the skin. And having had treatments now that's regenerative on my skin, radio frequency treatments, ever since we started our practice 20 years, that was my thinking then, is that I will be able to really prevent the aging process and maintain at a certain state, and we are able to do that. So
there's like a buzzword for that, biohacking.
Yeah, so we are biohacking. We are Benjamin buttoning.
Yeah.
And then you get a brand new baseline. So whatever age you are, that is now your new baseline. So for us, this is our baseline. We look the same as many years ago.
Or
Our
better.
skin looks better.
Or better.
That is now our new baseline. And if we never did anything for the rest of our lives, this is where we start. But of course, that's not going to happen. We're gonna maintain. How often do you want to do it? So there are patients who have a lot more laxity, and they feel like, okay, I want to try it. They love the results. You can do it again as much as once every 3 months. And so if you have an area where you want to keep working on it, whether it's loose skin on your abdomen, your arms, your neck, you want to keep lifting the brows and you don't want surgery, you can do a series of Sofwave treatments or any of the treatments. You can do a series of time machine, a radio frequency microneedling, pixel lift, and you just keep building. That's regenerative medicine. Yes. Yes, you can do any area of the arm. Inside of the arm by the elbow, there's a lot of laxity there.
We've had a lot of patients do
The
that.
knees, the back, the abdomen, if you've lost a lot. There are a lot of people who are on weight loss drugs like Ozempic. So you start really sagging. You start seeing the quality of your skin change with rapid weight loss. And our patients who are going through programs like that worry about that. And what we've done is we treat them, with Sofwave or time machine, with these regenerative therapies. And what happens is they don't get as much sagging as they normally would. And they prevent sagging and it treats sagging. Okay, now let's talk about what Sheena's doing. So we also are experts, dermatologists are experts in the skin. We're experts as well with the hair. And so a lot of people comment and give me compliments about my hair. This is all my hair. This is really all my hair. And I'm 52, I'm around the menopause, hormonal changes. And so hair can change. But when Angela did my treatment this Saturday of Sofwave, PRFM from my temples, she also did platelet-rich plasma injections for my scalp. And so we do regenerative therapies, exosomes, the Elevite Empower Serum can be microneedled on the scalp as well, done on the same day as your PRP. But for maintenance and also just overall improvement in the health of your hair follicles, we have Keravive. And so go ahead, Sheena will talk to you about it, and maybe we'll go close up so you can kind of see and hear what's going on here.
So, hair
Closer.
thinning, hair breakage, that can be because of poor scalp health. So we're starting first by doing a deep cleaning of the scalp, which will really help if you have a dry scalp, if you have some clogged follicles there. Also, if you have buildup from product, that can really contribute to poor scalp health, poor circulation, but also with all the buildup too. So we start with a deep cleanse. I kind of part it about an inch or so. And this is actually using some beta hydroxy acid too. So it's not just water, it's not just the suction, the vacuum suction, but it also has really gentle enzymes. So it's safe enough for the scalp. It's not going to cause any irritation. The beta hydroxy is really gentle to dissolve that dead skin that we get from buildup. And then after we do the deep cleaning, we'll infuse with the keratin. And then you also get a at-home product that you use, that you'll use daily to help your hair and your scalp. So yeah, we're just doing a little deep cleaning here. We did this side already. And
how does it feel, Val? It feels like it would be good.
Yeah, it kind of
Relaxing.
It's nice. Anytime you're getting your scalp touched, it feels good. So
look at this.
I'm
This
like
is like a
really
treat.
relaxing right now.
This is a treat. And for those of you who are feeling like, you have maybe dandruff or psoriasis on the
so dry
scalp.
right now.
Yes, dry scalp, itchy scalp. This is really a wonderful, wonderful treatment. The other thing is if you're feeling like you're starting to experience some hair thinning, hair loss, breakage, this is really wonderful because it also will allow all of the other treatments that you're doing, if you're doing minoxidil, PRP to your hair or other products, it really allows that to work better. So the combination treatment. And then also,
hydrated. So it's just a little dry, a little red, but this it already looks better. Because at first it was just a little red, but here it's a lot more hydrated. The hair looks better, more healthy already. Good on this side.
Awesome. And so talk a little bit about Hydrafacial because Keravive is Hydrafacial and the types of Hydrafacial we do too. And we actually performed the study that showed that Hydrafacial is highly, highly effective for treatment of acne. 100% of patients got better and 100% of patients report that it improved their self-confidence and self-esteem, which is super, super important when we're talking about acne patients. And this is a treatment that is very comfortable, all skin types, and
very gentle, good for men because a lot of times they have a thicker skin, more clogged pores, more hair follicles on the base. And this is really effective because we're deep cleaning the pores. This one is the cleansing tip, but we do extractions with the machine. So any skin type, I think my youngest patient was maybe about 9 or 10.
Yes.
And then my most mature patient was 99.
Yes.
Exactly.
So
Okay.
It's
Yes.
99.
Anybody
That is, they know that any patient who comes in, if you're 80 or older, you get special discount at M Beauty because it just warms my heart. But yes, our most mature patient is 99. You're never too old to really care. You're never too old to really take, feel like, yes, skin health and self-care. And Hydrafacial is wonderful. Immediately you get an instant exfoliation and you get this polishing, tightening, the glow. And if you have bumpy skin, if you're a teenager or you are starting to get blackheads, whiteheads, it's wonderful. It's the most gentle way to extract.
Very gentle. We also have more effective things like the glow peel.
Yes.
So that's more for pigment, texture, sun damage. But the Hydrafacial is great for clogged follicles, blackheads, or just if you feel like you need a deep cleaning for the pores.
Yay. And then we finish off our Hydrafacial with the red light treatment. So we're going to do that for Val. And while we're doing that, we'll set up our phone back here. And then we'll talk about some products. Yes. Question? Oh no. Yes. So depending on the reason, under eye discoloration, dark circles, it's a genetic thing. As the skin thins and the under eyes, we start seeing the blood vessels, and sometimes it's a circulation issue as well. But essentially how PRFM can help with that is, one, it helps rejuvenate the actual skin. So the skin becomes thicker. And then if we combine that with radio frequency microneedling, intense pulse light, time machine resurfacing with fractional radio frequency, and then the skin gets better. And then the platelet-rich fibrin matrix, like I mentioned before, the injections will naturally volumize that area without risk of blindness, lumpiness, excessive, swelling, which you can get with hyaluronic acid fillers. And hyaluronic acid fillers, your skin itself is not any younger. It's just temporarily filled. And I'm all about, again, biohacking, the way to, to aging or anti-aging or pro-aging. People don't like the word anti-aging anymore. It's pro-aging. We're very blessed to be, I'm blessed to be 52, and I want to just, feel and look as good as I can. And we're so lucky we have incredible technologies now. So red light, super, super hot for 2024. Red light and LED red light is a lot of benefits, decreases inflammation, activates collagen production, and it's also very, very relaxing for people, right? Say you want to say
Fall
something?
asleep.
Yes.
Which it is really bright, but it's supposed to kind of mimic the natural sunlight and the healing effects from the natural sunlight. So when you're under here, I tell people it's gonna feel like the sun is right on your face. But it is actually relaxing after your eyes adjust. Just takes a minute. But I can also hold it a little bit further away from you if your eyes are sensitive or if you're a little claustrophobic. So
That's how nice
very
Gina
nice.
is. She'll hold it for you for like
I was
5 to
just
10
gonna-
minutes. I'd be like, you get used
Yeah,
to
you'll
it.
be fine.
That's Angela. I
You
would
would
hold it up
You would
too.
hold it. I have fun practicing to me. I'm busy. It is kind of bright, and I just want people to feel comfortable and be able to relax under this treatment. So surprisingly, yes, there have been some people that fell asleep under here. It's very relaxing, and I think it makes a big difference in the pores, in the tightening, in the inflammation, redness. It's very good for wound healing, but also it's boosting your collagen, so great for fine lines and wrinkles.
Yeah, so what we're doing, this comes with our Hydrafacials, right? The brightening Hydrafacial, acne Hydrafacial. My son actually, he loves this.
I know, I love this.
Yes, he loves this. And we also, after some of our treatments like the time machine procedure or Sofwave, they're hanging out, the patients are hanging out, we can do the red light treatment as well. So that's something cool that we incorporate with our treatments, and it really takes the results and the experience to the next level. Because I do feel that, and I know, and studies have shown that your experience, your psychological well-being, being in the place, whoever is treating you, the place that's treating you, if you feel like you're being cared for, if you feel like you can trust the people, they really care about you, your results are better. Because a lot of the treatments that we're doing, we're really asking our immune system to really work with us, and our psychological and mental status affects our immune system, right? So that's why we have a very warm and loving and caring environment here. And with Sheena, with Val, I'm not sure about Rick. Sometimes depends on his.
Depends
Angela,
on my mood.
but for sure, Julie, Jel,
Really nice too.
Lisa.
Super nice. You're so
yes,
sweet.
Christine, yeah. Okay,
Angela's hit and miss.
yeah, so, but but she is funny. She is funny. Okay, so next let's talk about how much time do we have? We're getting close. Okay, so let's talk about the specials, right? Before we end, because those of you who are staying with us till the end, your name will be entered in a raffle, and we will contact you, right, by email, and we will announce it on Instagram, and you'll also be notified as a winner. So, and then as far as the specials, let me see. Okay, here we go. For our New Year Better You special, this is really something that we haven't really done here in our, especially in our San Diego, Beverly Hills office, but you are going to get, for coming to the Zoom event, buy two, get one. So you buy two, get one for your IPL using the Versa IPL, acne laser, Hydrafacial, Glow Peel, which is amazing, and the Venus and the Keravive treatment, and the Venus Freeze treatments for your face or the body. So again, let me say that again. Buy two, you get one free. So you don't have to wait until you've done 5, then you get the next one free. Buy two, get one free of the IPL. IPL is still our mainstay, our workhorse Venus Versa Pro. Intense Pulse Light addresses discoloration, sun damage, redness, rosacea, post-inflammatory hyperpigmentation, very, very gently. If you have acne and acne scarring, it will help. So that's IPL. If you just want to even your skin tone so you don't have to wear a lot of makeup, IPL is really, really wonderful, and it's good for all ages, and there's absolutely no real downtime with that. Acne laser with our Hydrafacial and the Glow Peel. If you come to see us for acne, we usually have you do a combination protocol where we're rotating these treatments. And it works really wonderful because we're addressing both active acne, preventing new acne because we're doing extractions, and we're also treating acne scars. And the Venus Freeze and the Venus Legacy for the body uses radio frequency for a very, very wonderful, relaxing way to tighten and firm the skin. And then the Keravive you guys just saw. And so what else? Let's go over some products. Sheena, let's go here.
So
Sheena, I'll talk about.
things here.
Yes,
Vitamin
these
C,
are a few of our
Everybody should be on this for sun damage, anti-aging. This is a nice way to brighten during the day without having to use acids or making the skin sensitive.
I love the vitamin C.
This is our favorite.
I love
Yeah,
it.
so let me just say a little bit about why. There's so many vitamin C products out there. Why is Alumier MD vitamin C, E, and peptide? Well, that already makes
This
it
is
better.
the best one for sure.
Because it's not only vitamin C. This is pure vitamin C, 15% vitamin C, plus vitamin E, which allows it to be very moisturizing. It has an anti-inflammatory effect, vitamin E. It has a synergistic effect to be an antioxidant. So not only are you getting better results, you're also not getting the same type of potential irritation that you get with just any vitamin C. And then the potency of this being pure 15% vitamin C is really amazing. And you also get the Trixel peptide. So the peptide adds as well for the building of collagen, and it helps with fine lines, wrinkles. So you're getting kind of an overall rejuvenation with this. And it comes in this very, very incredible proprietary delivery system where we don't even mix the vitamin C pellets in the vehicle until you are ready to use it. So part of the thing that happens with vitamin C serums is that it gets oxidized and it's no longer viable when you're using it. And so you can see it's a glass bottle that's dark because whenever sun hits vitamin C, it already oxidizes it. And so we're keeping this as fresh as possible. Okay, next. Oh, eyes. This is my favorite under eye product, guys. I've tried a lot. Alumier MD's Illumini is so awesome. Why do you love it?
It has some little light reflecting powders in there, but it also has the glutathione. So it
Yes.
helps with dark circles, has a lymphatic drainage. So it's getting out that extra water, that puffiness. I can definitely see a difference after Hydrafacial when I put it on. It's almost like, I don't want to say a concealer, but you immediately can see the under eye brighten. It has the light reflecting.
Right.
So that one is nice. But you can also use it at night too.
I use
Definitely
it
brighten
twice
at
a
night.
day, and I have very sensitive skin, but I can really use it twice a day. Glutathione, let me just say, because it's hot every year. You know, that glutathione IV antioxidants, we offer it at M Beauty Clinic. High dose vitamin C. You already know why vitamin C is great for the skin, but glutathione is also incredible for the skin. It decreases the activity of your pigment cells. So if you have any type of discoloration issue like melasma, you're prone to dark circles, and you just want to brighten and have a nice glow, glutathione is great.
Also
But
for like eczema.
yes, it decreases inflammation and it boosts your immune system. And so that's really amazing. So we do that, and I usually do it once a month. You can come in. It's a very, very quick shot. Angela and Rick are amazing sharpshooters. And
Angela's the best. So make sure you
Angela's
ask
the
for her.
awesome. And so, but IV glutathione vitamin C, I am a huge, huge believer. I love it. Okay. Sunscreen. Alumier MD have incredible sunscreens. We can customize it based on what your skin is. So if you are acne prone, you can't use just any sunscreen. If you want tinted for discoloration, if you have darker skin, you can use the tinted. If you're dry, more mature skin, and maybe around menopause or postmenopausal skin, you have sheer hydration. So that's one of the things I love about that. And then IntelliBright, say a little bit something about IntelliBright, and then we'll finish with the Infinity.
This IntelliBright is really nice. This is for brightening. It's using kojic acid, so it doesn't have retinols, it doesn't have lactic acid or anything like that. So this is what I like to recommend for people who maybe haven't used a lot of brighteners, or maybe they're really sensitive to retinols or had a bad reaction with some acids. This is really gentle. You could use it during the day, although we recommend for people to start using this nighttime only until your skin gets used to it. So probably something that you'll use maybe 2 to 3 times a week or so when you're first getting started, but we can kind of coach you on how to boost up or to scale back if you're having any issues with it. But this one is really nice with the kojic acid, more of like a natural brightener.
Okay, and then
Next, or are there more products?
let's talk about okay, so why did we choose Keravive for our exosome? Because there are a lot of exosome products and companies out there. Exosome is really one of the hottest trending.
Yeah, like the concept of
exactly.
it.
What is exosomes? Exosomes are small vesicles that are secreted by stem cells, and they act like tiny envelopes. And it can contain really incredible types of proteins, so that you can get rejuvenation, repair, and healing of the skin. And so we use 2 types of exosomes in the clinic. We use the Empower, and that's what you saw immediately after the Time Machine or RF microneedling, or after
immediately post procedure.
right after the Sublamax. But one of the cool thing about Keravive is that it also has an at-home treatment, so an at-home serum called Infinity, and so this is something that is unique to Keravive. You can actually apply exosomes on your skin. I use this twice a day after I wash my skin. This is the first thing that touches my skin because it's exosomes, but not only exosomes, it also has vitamin C, has hyaluronic acid, it has niacinamide and copper peptides. And also Keravive, is not all exosomes are made the same. This really is unique because it comes from the purest and youngest day 0 stem cells, which has a higher potential for rejuvenation than other older exosome sources. So that's why. So, you know, I always do my research so you guys can trust that we're always having the cutting edge. And so that's Elevite. Okay, and then finally, what is
So
this?
finally, it's one of our other favorites, Jeuveau. Now you know.
Now you know.
So Jeuveau is great. Jeuveau is one of like the little tricks up our sleeves that we can
Oh
use.
yes, and a raffle winner will win 20 units of Jeuveau.
So that's $360 worth of
Mhm.
Jeuveau. Jeuveau can be used essentially anywhere from the neck up now. Actually,
Anywhere
even
where you
anywhere.
get Botox.
Yeah, so we like this a little bit better because it's a little more natural. Like, so we've been using Jeuveau. We were the first ones in Southern California to start offering this. We can essentially give you the same result of another very popular product out there, but we can make it look undetectable.
Right.
So that's very important. So some popular areas that we use it on are the eyes. It helps to minimize the squinting mechanism that happens on the side. We can use it on the frown. When we use it
Okay,
here,
come closer. Let's
it
come
helps
closer.
people look a little bit more relaxed.
Mhm.
For the forehead lines that go across.
Who
Little
did
bit on
mine last time? Zing Rick.
I think
Rick.
bunny line.
Rick is a Jeuveau expert, guys. So if you ever want Jeuveau, schedule your appointment with Rick. He is so like meticulous about
Very
Jeuveau.
precise.
Rick, okay, yes. So the raffle winner, your treatment, lucky you, will be with either Rick or Ange. And they're the ones that treat me because
Rick.
I cannot inject myself. So you know.
The other area it can be done on is the lip flip. So that's almost like a chemical lifting of the upper lip. It's
More of a show. Of your
yeah,
face.
so to increase the visibility of your upper lip here.
Yeah, the pink-
Surface area.
yeah.
You can do it on the even further
Yeah.
part of the upper lip, and that helps with the lines that go up and down.
Mhm. So those vertical lines, everyone hates them.
They used to be called smoker lines. I don't know if they're called that anymore. You can do it on the chin, and it minimizes the orange peel appearance. You can do it on the corners of the mouth, and that minimizes the kind of
The
frowny
RBF.
face.
The RBF.
Yep, you can
Yeah.
do the jowls. You can do the
Mhm.
masseter, which
Yeah.
are the big jaw
This one
muscles.
for
And then
clenching.
you can do the neck. All of it
Mhm.
all together. Originally, everyone used to do it for the upper face.
Mhm.
Now there are a lot more advanced techniques that you can do where you can do the bottom of the face with the neck, and in combination, you can
Get a
actually get a
snatch
really
job.
nice
Yeah.
lift of the neck.
Thank you,
and the
Ange.
jawline.
Ange treated. So because I was filming a lot of segments today on TV, and when I talk, I'm like so expressive and so passionate. I tense up my platysma, my neck muscles. And so I told Ange, I'm like, I really need this to treat. And you treated me.
How
on
can you say
Saturday.
no?
And then yes, you can get a nice snatch jawline as well.
Angela's the best. Always ask for Angela.
Nice.
Okay, and then there's a what else? Raffle. So for the raffles, you get there's a winner for the Venus Freeze.
Ooh,
That's really great.
nice
And
and
you can use it for your
lifting.
face or your body. A Hydrafacial.
A deep clean for the skin.
Yay.
Love that.
And a Keravive.
Wow, that's a super big ticket
So
item.
there's four. So Venus Freeze, there'll be a Venus Freeze winner, Hydrafacial winner, and 20 units of Jeuveau and Keravive. So we will announce that on Instagram, and we'll contact you personally since you stayed till the end. And then the specials again, buy two, get one of the IPL Acne Laser, Hydrafacial, Glow Peel, Venus Freeze, and the Keravive. And
Are
I
all
think,
of these treatments available at each office?
yes.
So we have 3 offices: Beverly Hills on Rodeo Drive, our main office in San Diego, Miramar, and then we have another office in East Lake.
Right.
Um,
And also there's free consultations. So if you have any questions and you just want to be educated, we went through a lot, and that's usually what we do with Zoom because I have ADHD. So
and a lot of energy.
but hopefully you got your time's worth. We wanted to make this really wonderful and useful for all of you. We are celebrating our 20th year, and we just thank those of you who are our current patients. We are so grateful for all of you. It truly means a lot to us that you trust us with your care, with your family. and with your friends. We really appreciate referrals, and that's really, how we've grown the practice from day one. And there's a final question I heard. 10 questions about when Wanya comes. 10 questions.
I don't think you'll see him till the end of the road.
Oh!
I
That was good.
think we've come to the end of the road.
Yeah,
You know, we've come to the end of the road of our
Okay, the question is, there are 10, someone typed in 10 times.
No, there are 10 different
10
people
different people.
who have asked.
Okay,
Okay.
they asked, when are we bringing Wanya for a Zoom? Or FaceTime. Okay, so maybe we'll request that. So
Maybe
Wanya,
one day.
Wanya,
Maybe
I'm
one
going
sweet
to
day.
Sorry, man.
No.
So,
We gotta
okay.
wrap it up.
So, yeah,
We have
so-
to respect people's time.
Wanya was here, and Angela serenaded Wanya
I
while
can't believe
he
I
was-
did that.
he was getting his
I can.
treatment.
I
He did,
know.
yes.
Something came over me
It's
and I
like
just really
Sofwave.
did it.
Yeah, it looks great.
Oh, he
And-
looks wonderful.
And
loved
thank
it.
you as well to his beautiful, amazing, sweet wife, Amber.
We love you guys.
Yes,
we
they
love
were
you,
here
Amber
in
and
San
Wanya.
Diego. Love you, Ann. Okay, so that's the request. So I'm gonna ask Amber and Wanya. Maybe we'll do a FaceTime or a Zoom with them next time. Oh, fine.
Why don't we go back to the Bay Area?
Oh,
Oh.
one sweet
I don't
day.
know one song.
Okay, question. Last question. When are we going back to the Bay Area? So, okay, we're gonna try. Lisa, do you want to?
It's
Lisa?
hard. Tessa's really busy now. Like Rick's busy with his now. I had 2 kids too, so it's like the dynamics of it of us getting up there. It's quite difficult.
Yes.
actually.
But if you are a very loyal Bay Area patient, let us know, and we'll
Mhm.
give you maybe a break on
yeah,
your.
contact us
Yes.
and then let's see what we can do.
can
For you.
do.
We love all of our
And
patients.
if there's like a leader / manager there, if you guys, put together 20 patients, we'll go there.
That is true.
Yeah.
That's
A
true.
leader.
Yeah.
We will. The Stanford,
Organizer.
Coordinator.
Stanford, the School of Medicine has their alumni reunion usually around the month of April. And so maybe we'll do something then because it will be there. Okay?
Oh,
Da-da-da.
thanks for that comment, James.
Thanks, Tessa's husband.
Thanks, Ma.
Thanks, Ma.
My mom was up here.
Thank you so much. Let me just say that I truly believe we do have the best team. And if you haven't been an M Beauty patient, we really promise that you will feel like you're very, very loved, we're very well taken care of. And we do try our very best so that, you are getting not only the best care, best experience, but the very best result. And, this is year 20. You gotta
Can't
keep
believe it.
going.
And the thing is, for us, it's not just a job for us. This is our life. So that's what I really care.
The family.
I really care about my
me
patients.
too.
I don't know about Angela.
No, we take it
I'm 10
personally.
years in, guys, 10 years in.
You look so good. Look at sweet girls. Look
I
at
just had
them.
my little. I know
Yeah,
that's
so
what
did
I
I.
noticed. I was like, you look
Mhm.
so good.
Well, for those that, if you don't have downtime, Sofwave really isn't. If you have downtime, do the time machine procedure.
Or
Yes.
you can do
You know.
Sofwave and the Pixel.
Sofwave
That's
Pixel.
becoming my new favorite. That's the one that Tess
But
and I
there's still
just did.
downtime with the
24 hours,
Only a little bit.
24, 48 hours. So the zero downtime software. 1 day, 1 to 2 days, but really 24 hours, I'd say, of redness, swelling.
Social down.
Then so that's RF microneedling with Sofwave. And then if you have about 3 days where you can be slightly red, slightly swollen, you may get a little bit of bruising because we're going to inject platelet-rich plasma. Time machine is still the best to really.
5 days.
I don't know, 3 days for me. I
And
get
if you
it.
guys want to do Jeuveau, please don't. If you have an event, please don't go here that same week.
Yeah,
It's very,
That's true.
very stressful for us.
it takes 2 to 3 weeks to kick in, and although we try our best, and most patients don't bruise, there's still always.
There's the-
a
yes. Okay.
Okay,
Okay.
that's it. Oh,
Oh, one more.
Oh, when am I gonna go to Hawaii? Oh my
I
god.
don't know. We can't fly our stuff there.
Yeah, but see,
You
people
got
ask
reps- you
all
got
the
reps in
time.
Hawaii?
We do, but then we'll see.
Call
Thank you
us,
all.
just call us and tell us if you have to travel. We'll find some way
Yeah.
to absorb your
Yes.
effort. Okay.
Exactly. We appreciate your effort. We appreciate your loyalty. We will try to make things happen.
Plus, you're going
okay?
to San Diego. It's
Yes,
not like
yes.
it's not like our clinic is
It's not a
somewhere.
terrible place.
Yeah.
All right.
Okay.
Well, thank you all. We love you. Contact us for your free consultation. We'll contact the winners and definitely take advantage of the buy two, get one attendee only special. And we'll see you soon here at M Beauty Clinic. Bye. Bye. We got to end this one. That's